Hi.
Hi.
Mrs. Gallagher?
Yes.
I'm Ben
yes.
Lynch. I'm a fourth-year medical student.
Oh, it's nice to meet you.
At the University of Oklahoma, this young doctor has been sent to break some terrible news.
The cancer's migrated further than we had hoped, and kind of points us to the direction that this is kind of the final stage of your cancer. It's reached that point to where we can say that it's terminal.
Fortunately, Beverly Reardon doesn't really have cancer. She's one of thousands of amateur actors hired by American medical schools to help future doctors improve their bedside manner.
I know it will take my life when I'm ready, but I'm not ready, and I have plans. There are things that I want to do.
Today, med school dean Dwayne Andrews is watching with me through a one-way mirror.
I'm here for you, all right?
Thank you. I know you are.
She's so good.
She's very good.
Every med school hires standardized patients. But these days, patient simulations have gone much higher tech.
Well, we have mannequins that can simulate heart attacks, making urine, a coma.
Are they robots?
Well, you could call them robots. They're digitally controlled mannequins that have all sorts of moving parts in them that simulate what humans do in a variety of medical conditions.
These high-tech dummies aren't cheap. They can cost $300,000 each. But they never complain. They show up for work every day to train young doctors how to perform spinal taps, draw blood, withdraw knee fluid, find a deep artery, perform colonoscopies.
You'll see that patient will actually have pain if we're not in the right spot. And then sometimes they'll shout.
And even deliver babies.
When you feel the neck contraction, we'll push to the count of 10, okay?
Okay.
Only the bottom half of this young mother is fake. Oh, and the husband.
Can you give her a drug or something? She wants an epidural. Can you give her an epidural?
At this point, there's no time. The baby's coming. We can do this.
No.
6, 7, 8, 9, 10.
A little push.
Okay.
Just a little
A
push.
little push.
Oh my God, should it be covered with that goop?
Yeah.
According to Dean Andrews, these dummies may be soulless machines, but their job is to hone the human touch.
The whole purpose of medical simulation, beyond just better education, is really patient safety and the quality of care.
And how does that work? I mean, they're not real people. I mean,
No, but just imagine the difference if you've practiced it on one of these models 5, 6, a dozen times before you have to do it in a real situation. Your skill level is better. Your anxiety is lower.
Too much of medical education is, let me have you read the book, let me make sure you understand it, and then let me put you in a clinical environment to take what was in that book and do it on a patient.
Stephen Klasko is the dean of the med school at the University of South Florida, which owns the biggest simulation center in the country. He says that simulations may actually reduce the cost of healthcare because it can reduce lawsuits.
We can't transform this whole healthcare system and reduce readmissions and create better quality and have less mistakes without the ability, like the airline industry taught us, to simulate those models. Not just technically, but also from a teamwork perspective.
As training technology advances, the simulations grow more elaborate.
This is what happens with our military. It's loud. This room can get very hot.
At the University of South Florida, Dr. Luis Lorena teaches his students to work under the stress of the battlefield.
You're going to have 30 seconds. When I give you the time, go intubate in 30 seconds. Starting now.
He even adds the sound of helicopters for added realism.
Pressure's dropping. I don't have a pulse. All right, not bad. 15 seconds, you got it in there.
And back in Oklahoma, the professors are putting these future anesthesiologists through some external pressures of their own.
Our patient is a 25-year-old gentleman who suffered blunt abdominal trauma.
They'll be subjected to a whole range of unexpected disasters.
And David Pogue is going to be our surgical intern.
Including an incompetent assistant.
I'll pretend like I don't know what I'm doing.
Sir, we're going to go ahead and put this breathing tube in, okay? We want you to be totally still for us.
Incision? We got a lot of bleeding. I think he's got a severe liver laceration.
Behind the one-way mirror, the instructors control the patient's fake blood.
Here, Dr. Pogue.
All right, let's
stop the bleeding here.
I'm going to stop the bleeding?
Apparently, I wasn't very good as an intern, even with a plastic patient.
Dr. Putnam, please take over for compression.
I guess I'm terrible at it.
But my incompetence was only the beginning of their problems.
There's smoke.
Smoke?
There's smoke in the operating room.
Let's turn off the oxygen. Let's pull back the drapes.
Looks like the drapes are on fire.
All right, is the fire out?
I think the fire's out.
Thank you. Good job, guys. Simulation is over.
Simulation is over.
Wow, you made the drapes catch on fire? Now, how often is that going to happen in the real world? Is that useful training?
It happens every once in a while.
It happens over 100 times a year, and in operating rooms across the nation. So, wow. Yeah.
As it turns out, the equipment wasn't the only thing doing an acting job. This anesthesia mannequin gave an award-winning performance too.
Dr. Oliver, what things can this dummy do that are like a real person?
When we give them anesthetic medicine that makes them go off to sleep, his eyelids actually drop down. His tongue can swell up.
In the middle of a simulation, you got caught up in it, and you begin to forget that it isn't real because you're trying to manifest, how do you do this? How do I best take care of this patient?
Robotic patient technology will certainly improve. But even now, these hunks of plastic and circuitry are serving us all tirelessly and expertly. They ensure that even on day one, the young doctor at your bedside has already had years of practice.
So this patient ultimately would have survived?
Yes.
I think it was largely due to the skills of the intern.